Well, we've discussed ankle sprain grades, different types of problems, the recovery process, of course, non-surgical versus surgical. But one of the most common questions revolves around ankle sprain recovery exercises and stretches you can do at home. Well, again, it kind of depends on the grade, but I would say if it's one, you can go right into more of the aggressive exercises that I'll discuss in a second. A grade two, partial tear, and of course a complete tear, you're going to want to wait until about week two to start doing some real passive movement, and then three to get a little bit more aggressive. And let's go through those. So some of the most passive movements sounds a little odd, but we call it the ABCs, or just go ahead and spell the alphabet. So with all this healing on the outside of the ankle joint, a lot of times just a little bit of moving up and down, side to side, any kind of movement. Remember, the ankle goes four directions: this way, up and down. Spelling the alphabet, A, B, C. By the time you get to Z, I know it sounds a little overdone, but you have flexed and at least stimulated all the muscle groups in the lower leg. Then you can graduate to something a little bit more aggressive, where you're at least putting your foot on the ground. And I wouldn't go too crazy, but just scrunching the toes up on a towel, that'll get all the flexors on the inside here, the inside ankle joint. That will also, and like I said, moving it up and down will get not only the front ankle joint, muscles and tendons, but there is one on the outside called the peroneal tendon. We'll get to that one in a second. And with the stretchy bands or elastic bands that TheraBands that we actually ask you guys to purchase. One that's a little bit in between is where you could put a little bit of a towel. I'll illustrate with this paper towel here, but a regular bath towel on a kitchen vinyl floor or a wood floor, hardwood floor. And if you put the weight of your foot on and you kind of push it along, and you push it along the surface, and then you evert and you push it this way, that'll get the insides and the outsides again, along with scrunching the toes, getting the flexors, and then just pulling it upwards is going to be painful enough because you're pulling up towards the injured area here and wadding up the tissue. So I just think that that type of slight friction and then a little bit of non-weight bearing exercises is probably the best to do for about a week. Now, after that, you can get into a little bit more aggressive stretching. We never want you to do too much of the downward stretching for the obvious reason that the talofibular ligament and sometimes the calcaneofibular ligament, once you push the foot downwards, does stretch it out a bunch. I tell patients, watch it in bed for the first week or two, where your foot can get pushed downward by the covers. Wear the walking boot or splint or ankle brace that we give you to bed just to kind of keep it in place. Once those congeal, you can get a little bit more aggressive with the stretching. Of course, the regular calf stretch where you lean up against the wall with two arms against the wall, one leg back, one leg forward. Lean into it. The foot goes forward this way, and you can feel the pull on your calf. One extra tip, if you can, while you're leaning forward, if you can pull the toes upwards, what that does is that flexes the muscles in front of your leg, which automatically tells the muscles on the back to relax more, and you'll get a deeper stretch. I would hold on to those for about 30 seconds, a set of 2 or 3 every morning when you get up, every night before you go to bed. Those types of patients that do the morning and night stretches just do the best. And then again, the TheraBand. It's not rocket science. You wrap it this way. So if it wraps around the front of the ankle, or the forefoot that is, just in front of the ankle joint, and you have it this way and it's looped around, and you can hold onto it or tie it to a leg of a table, then you can go ahead and pull your foot in and do exercises on these inward muscles, the posterior tibial tendon, and then wrap it the other way. And so the lateral portion and the medial portion, the inside portion, is tied to something. Well, then you can evert against that. I would do 2 sets of 10 every day. 1, 2, just let it recoil, and you can keep it as firm as you want. Of course, pain will be the limiting factor. And remember, a little bit of achiness at night is okay. Throbbing at night, no, that's a bit too much. And of course, if you have any kind of morning pain, I tell patients that morning pain is usually injury pain, When you feel that going away, you step out of bed, it's just a little bit of tight, you'll know you're close. But again, those are some fun, easy ones. There's others, and of course, a local physical therapist is always a great idea, and you can get that prescription from your or order from your physician. Again, hopefully that was helpful. We have other ways of getting a hold of us at the Ask Dr. Moore channel, where you can see other Ask Dr. Moore videos, and you can ask your own questions if you'd like in the comments section, and I'll do my best to get to those questions on a monthly basis. Thanks for tuning in. Stay healthy and one step ahead.